Hi everyone, Dr. Brooke Kolesiak here, Legacy Physical Therapy. Today we're going to come back around to talking about sex, pain with sex, that is. So we're going to talk about a condition that we commonly see here called vaginismus. And so vaginismus is a condition in which there is involuntary muscle spasm of the pelvic floor muscles, and this prevents vaginal penetration. Okay, so when a woman has vaginismus, her vagina muscles end up squeezing or spasming when something is trying to enter the vagina. This could be a tampon. This can be the speculum in the gynecological exam. This can be penis insertion or other insertion with intercourse. So it can range from being mildly uncomfortable to being painful to being completely impossible to happen. Okay, so painful sex is often a woman's first sign that she is experiencing vaginismus. Majority of the time, the pain happens only with intercourse. It usually goes away after withdrawal, but not always. And our patients have often described the pain as a tearing or ripping sensation, maybe sharp knife-like pain, or feeling like something's hitting a wall, like the door's closed, there's a wall there, nothing can go further. So those are all explanations or descriptions of the pain that we have heard. Women who have vaginismus most commonly feel the pain with intercourse. However, many can feel that pain with or discomfort with inserting a tampon and during a doctor's internal examination for like your gynecological visit. So, and again, it can range from these events being completely impossible because the pain is so bad to just mild discomfort in the situation. So some women have vaginismus in all situations with any type of penetration. Others only have it in certain circumstances, like with one partner, but with not another, or only with sexual intercourse, but they're able to use tampons or have a gynecological evaluation. There's a fair amount of variability that can happen as far as what people can experience. So the good news is that unfortunately, not many women are aware that there is treatment. And that's why today I wanted to share with you a patient's story, with her permission, of course, just to give a little bit more context to the situation. So Pam is a 38-year-old teacher who first came to us for one of our pelvic pain classes. And when she was sitting in class, when we started talking about vaginismus, her eyes just like lit up wide with recognition. So after class, she came and spoke with us and said that she's been unable to have sex for the last 20 years because of pain. And she went on to say that she's seen many providers and endured many painful gynecological examinations, but never received a diagnosis or any suggestions for treatment. It was actually her friends who were sex and trauma therapists who recommended that she try pelvic physical therapy. And Pam admitted that she had never heard of pelvic PT until her friends told her about it. And unfortunately, this is a sentiment that we hear way too often here at Legacy. So Pam called up her current gynecologist, requested a referral to pelvic physical therapy, and got her evaluation scheduled with us for the next day. So after a thorough evaluation, we determined that Pam did indeed have vaginismus, that involuntary spasming of the pelvic floor muscles with attempts at vaginal penetration. So we started out helping Pam learn how to relax the pelvic floor muscles and move them more using different techniques like visualization, deep breathing, and active movement of the pelvic floor muscles. And so once she was better able to locate and move the pelvic floor muscles and help them relax, we introduced something called vaginal dilators. And I have a few samples of them here today, so I'm going to bring them up in front of the camera so people can see. So vaginal dilators, they come in all different sizes and flexibility. So this one's a little bit more flexible than this one is. They can be an extremely helpful treatment option for women dealing with pain, fear, and or anxiety associated with any type of touch at the vaginal opening or insertion. And like I said before, they can range in size, so we can progressively go up in size from smaller to larger so that women can get a graded exposure to stretch of the vaginal opening and the pelvic floor muscles. So back to Pam. Pam worked with us for several weeks and was able to successfully progress up in size with the dilators over time. And after about 8 weeks, she came in for a PT appointment and just sat down in the chair and started to cry, something that also seems to happen here a lot. But these were tears of joy because she said that she was able to have pain-free intercourse with her partner for the first time ever. And we couldn't be more excited for her. Honestly, that's one of the reasons why we do what we do here, is so that we can help women be the way they want to be in the relationships, the way they want to be, and not have to worry about pain or fear. So Pam's story is one of those that we hear, unfortunately, all too often here at Legacy, where she went years, decades without knowing that there was an option, without getting answers to why she was feeling what she was feeling. So if you or someone you know is experiencing pain with vaginal penetration, please know that you are not alone and there is help. You may have to advocate for yourself, but seeking out the care of a pelvic PT can make all the difference. And so we just want to know that we are here for you. And even if you're not local to St. Louis, if you have questions and want help or answers, we want to make sure that everyone knows that there are options available out there for them. And so please feel free to reach out to us privately or leave a comment and we'll follow back up with you. But we just want to make sure that women are getting the information that they need to get the treatment that they need, because vaginismus is something that is completely treatable, oftentimes with the combination of pelvic floor physical therapy and potentially working with a sexual counselor as need be. And so we want to make sure people get connected up the way that they need to. So hope that you guys found that informational today. If you have questions, please reach out, shoot us a comment, shoot us a message, and we will be back next week to talk all things more pelvic health. Take care. Bye.